Hello everyone, a very good morning. Sorry for a delay in posting this as my iPad and my iPad pencil was not working, so I was not able to post your videos regularly. Sorry. So from today onwards we'll post the videos regularly. Here we'll discuss about RBSK, that is your Rashtriya Bal Swasthya Karyakram. This is a national program which has been asked many times in your university exam as your short notes. RBSK and DEAC both have been asked in your university exam multiple times. So we'll discuss this topic today. So going on with the introduction, you need to know that here in India we have around 6% of birth defect and 10% of the children go into developmental delay. This is a survey. Okay, it is all over our country. This 10% of development delay is leading on disability. So this together will leading to 10% of neonatal mortality, for which we have got the national program as RBSK. Right? Yes, in RBSK there is an early identification. So important points are, there is an early identification and early intervention. So who are beneficiaries? So every national programs, you have to know the motto of a national program, and you have to know who are all the beneficiaries and which team is doing this national program, or what is the composition of the medical professionals doing this program. Okay, so early identification and early intervention is the motto of your RBSK, and the beneficiaries are covered from birth till 18 years of age. And what it covers your 4 Ds. What are these 4 Ds? That is very important. These are your key points in your exam. So your 4 Ds are your defect, deficiency, next will be disease, and fourth will be your development delay including disability. So these are your 4 Ds: defects, deficiencies, disease, developmental delay with 4 Ds. With disability. Next, age and screening. How do they screen from? So beneficiaries are from birth till 18 years of age, and how are they screened? How are they being separated while screening? So the first level of screening. That is within 48 hours of birth. That is within first 48 hours of birth will take place at your delivery points. First level of screening will be taken place at the delivery points. Delivery points is mainly your PHC, CHC, your district hospitals. So these are your delivery points. So within first 48 hours, the child will be screened at these delivery points. That is your PHC, CHC and the district hospitals. Fine? Yes. Who will screen these children? These children will be screened through your existing MOs, that is medical officer or staff nurse, and your ANM. They will screen these children who are delivered at their particular center. After 48 hours till 6 weeks. After 48 hours till 6 weeks of life, they will be screened by your ASHA. So they will be screened by ASHA as a part of your HBNC Act. What is HB? It is a home-based newborn care, as a part of your home-based newborn care program. So as a part of home-based newborn care program, this ASHA will screen the children from 48 hours till 6 weeks after the birth. Next, from 6 weeks till 6 years of age, these children will be screened at nearby Anganwadi center. AWC is nothing but your nearby Anganwadi center through your mobile health team. For our mobile health team, I will come later. Okay. Next, children between 6 years to 18 years of age, they will be screened at the school. This in school mainly these are government and government aided school. So they will be screened in the school through, mainly in government and government aided school through the mobile health team. So that if the child is screened and referred from any point of identification, whether from this delivery point or from by Asha or at Anganwadi center or at school, they will be referred to their district health hospital or they will be referred to the DIC. The treatment and intervention is delivered at zero cost to these children. Okay. So the treatment will be delivered at zero cost. Fine? Yes. Next, how is the screening being done? What is the mechanism of screening? So the mechanism of screening takes place at 2 levels. So mechanism of screening takes place at 2 levels. That is, first one at your community level. Next one is your facility level. Facility level is based on your newborn screening, that is at the delivery points. They are doing the delivery points. No, this is a facility level screening. That's based on the newborn screening that is done at your PHC, CHC or your district hospital. While community level screening is mainly done at or conducted by your mobile health team. So community level screening is done by mobile health team at your Anganwadi center and your government and government aided schools. Right? Yes. So we will see at Anganwadi center how are they screening. So at Anganwadi center, screening takes place twice a year. Screening takes place twice a year at your Anganwadi center for your preschool children, that is between 6 weeks to 6 years of age, and age specific developmental tools are used for screening these children. So age specific development tools are used to screen this children. Right? Next, at school, that is your government and government aided school, children between 6 to 18 years are being screened here. They are being screened at once a year basis. The tool that is being used here is their questionnaire. So they give you a questionnaire to the now it is all based upon your app, that is in your online app. Okay, so there will be a questionnaire that is being given to this, and the teachers will fill the questionnaire by asking to the children what are they feeling, and like nearly 30 questions are there in that, and the teachers will fill in that questionnaire, and we doctors, that is in the mobile health team, the doctors that are present in the mobile health team will go and verify the questionnaires, and will go and see mainly the children who are being selected by the teachers. That will be easy for the medical officers, for segregating the children. So mainly that way we use the screening in the schools. Okay, so mainly we use questionnaire method and clinical examination is done. Fine? Yes. So this is the community level screening. Well, facility level screening that is done by at PHC, CHC and district level hospitals. Right. Next, what are the composition of your medical team or mobile health team? Composition, who are being present in your mobile health team? So composition of mobile health team are, there should be 2 doctors, RBSK, that is 2 medical officers, an ANM or it can be a staff nurse, and 1 pharmacist. Okay, if this pharmacist is not available, other paramedics like lab technician or ophthalmic assistant can be present. This pharmacist should have an efficiency or proficiency in a computer for a data management, should have a knowledge about computer. Okay, should be proficiency in computer for data management. Right? Yes, this is the composition of your mobile health team. Next, what are the health conditions that are being screened in RBSK? There are nearly 30 selected health conditions that are being screened in the RBSK. So we can't remember every 30 medical conditions that are being screened. So I'll tell you one easy method, because if you write this one completely, you might be getting a full marks for this question, okay, in your exam. Yes, first is your, among the 4 Ds, first is your defects at birth. So how do you remember defects at birth that are being screened at RBSK? Is from head to toe you have to remember. That is, first one will be your neural tube defect. Second one, we screen for Down syndrome. Third one, you have to remember eyes. If from eyes, you screen for congenital cataract. And in eyes, you also have ROP, that is retinopathy of prematurity, that is in eyes. Fifth, in ears, congenital deafness, ears, okay. Sixth condition will be your mouth, that's your cleft lip and cleft palate. So cleft lip and cleft palate. Seventh condition will be your congenital heart disease. Coming to the chest, will be congenital heart disease. Eighth one will be your developmental dysphagia of hip. Ninth one going to your foot, that is your foot. So these are the 9 major defects that has been screened at birth or through your RBSK. Next, coming to deficiency. What all the deficiency mainly being screened? Mainly, you have to remember 2 minerals, 2 vitamins, and the general malnutrition. So 2 minerals are for your anemia, that is iron deficiency. Now, second one is your iodine deficiency, that is gout. Third, 2 vitamins are your vitamin A deficiency and vitamin D deficiency. And fifth one is your general malnutrition, that is severe acute malnutrition that is being screened. Next is the disease of the child. Disease of the child is quite difficult to remember, but if you can, you just remember the easy conditions. First one is your skin conditions. Skin conditions is mainly scabies. Second be in your ears, that is otitis media. Third one is in your heart, rheumatic heart disease. Fourth one in lungs, it is your reactive airway disease. Fifth one will be your dental conditions. And sixth one will be your convulsive disorders. Fine? Yes. Next is your developmental delay and disability. How do you remember the conditions in developmental delay and disability? Is by remembering a definition of your cerebral palsy. That is, what all you will be having, what are your developmental domains? Mainly your motor cognitive delay. Third one will be language delay. Fourth one will be your neuromotor impairment. Fifth one will be your vision impairment. Sixth one will be your hearing impairment. And seventh you will be come to behavioral, that is behavioral disturbances. So behavioral disorders like autism. Eighth one will be your ADHD, attention deficit hyperactive disorder. And ninth one will be your learning disorder, like a specific learning disability. These are the developmental delay and disability conditions that are being screened at your RBSK. Okay. Next, third tier medical condition will be your congenital hypothyroidism, sickle cell anemia, and thalassemia. That is based upon the place, okay, they are being screened. So these are the main points you have to remember in RBSK. Fine, in RBSK question, these are the main points you have to remember. Okay. Thank you. In next video, we will see about National Tuberculosis Elimination Program. Okay, or do you want me to take global developmental delay? Just put it in comment section which topic you needed, why the National Tuberculosis Elimination Program or your global developmental delay. Just put it in the comment section, we'll discuss that topic. So hereafter I'll make videos regularly, at least 2 days once I'll post the videos. Thank you. I'm sorry for the delay for the videos. Thank you so much.